The medical information included in this podcast is provided as an educational resource only. Please consult your healthcare provider before making any healthcare decisions.
You know more about yourself and your condition than your clinicians ever will because you live with it every day. And we look at objective data sometimes. We look at cardiac MRIs or we look at kidney biopsies or whatever the case may be. And that gives us a piece of the picture, but doesn't tell us the entirety of the picture. And so I feel really strongly the only way that we can advance care in Fabry or any other chronic disease is that it has to be a partnership, right? It really has to be a partnership where it is the patient and the provider, those group of providers. And I would even extend it in Fabry. It's not just the patient, it's the patient and their families.
Welcome back to the Fabrycast. Today we are going to talk about cardiac care, AI, and the power of a good patient-physician partnership. Today's guest is someone I deeply admire, not only for his brilliance in cardiology, but also for the compassion he brings to his work. Joining me is Dr. John Jeffries, a highly respected cardiologist based in Memphis, Tennessee. He's internationally recognized for his expertise in heart failure and inherited cardiomyopathies, including Fabry disease. And he's been at the forefront of research, innovation, and compassionate care. Dr. Jeffries is past president of the American Heart Association, and he currently brings his expertise to the court as the team cardiologist for the Memphis Grizzlies. But what truly sets him apart is his passion for partnership, for truly working with patients and championing emerging tools like artificial intelligence and digital health to create smarter, more personalized, and empowered care. Beyond the science, his commitment to listening, collaborating, and embracing innovation is making a real difference in people's lives. Dr. Jeffries, thank you so much for being here. We're absolutely thrilled to have you as a guest today.
Thank you, Julian. My pleasure. Honored to be here, and thank you for all that you do.
Thank you. I'm really forward to what we can learn from you today. For some of us with Fabry, we don't always know our heart is being affected until symptoms show up. And what are the early warning signs or subtle red flags you watch for in your Fabry patients?
So great question, Julia. I think, a lot of it sometimes depends on whether we know you have the diagnosis of Fabry or not. So a lot of that's obviously important. There's a lot of folks out there living with disease that haven't been diagnosed. But for people that do have carry the diagnosis, one of the first things we'll see on an EKG, for example, is a slow heart rate, what we would call sinus bradycardia. But we also know in younger patients they can have arrhythmias, so meaning unusual heart rhythms. So sometimes they're too fast, sometimes they're too slow. And oftentimes those would be accompanied with symptoms. So if it were too fast, you might feel palpitations like a racing heart, may feel a little dizzy, may even pass out. Those would be ones that would be concerning. A lot of the things we see cardiac related, more when it comes to heart and muscle disease, are usually a little bit later in life, but those can also be initial manifestations. So sometimes maybe having shortness of breath with exertion, swelling, things that could be consistent with heart failure would also be things that we would pay attention to. So I kind of put it into different buckets when I talk to patients. One is more the electrical component, and that's the heart rhythm, so being up maybe too fast or too slow. And the other thing I pay attention to are concerns of heart failure. So those are the two things you might pay attention to. And typical sort of complaints of heart failure patients might be swelling, might be weight gain, might be fatigue, might be shortness of breath with exertion. Those are things that if you carry the diagnosis of Fabry, you might want to dive in a little bit more and understand if it's something cardiovascular.
For sure. And you did list off quite a few symptoms that when I was listening to you say them, I was thinking in my mind, can we track this? Can the patient track this? And so I'd love to talk about AI and wearables and smart tech and how these tools are changing the landscape for Fabry patients.
Yeah, it's a great question. I think the beauty of wearables, the way I think about it for patients or even for my own self, is if you, let's say you do see a cardiologist as a part of your Fabry care, and maybe you're seeing them once a year, maybe twice a year, unless you really have significant disease, you're seeing them more frequently. So that gives you a very brief snapshot into what's going on. And maybe when you're there, you get an EKG, and maybe you do a Holter monitor for a day or two, you get an ultrasound of your heart. And what I use stay at conferences and to patients, which is really true, and it's meant to be a little tongue in cheek, but it's the reality, is that those are 2 days that we had a good idea of what's going on with you, right? So that only leaves 363 days that we're missing. So that's not very good. The odds there are not fantastic. So how could we better surveil patients? And some people, as you know, with Fabry maybe have implantable devices. So they have a pacemaker or defibrillator. And inherently, we can watch those patients from afar very, very accurately from a rhythm perspective and from other things as well. But most people still don't have those devices. So the question is, well, how else could we get at this information? And some of this is through what we would call remote patient monitoring. And this is kind of a very much a growing area of what we do in cardiology independent of Fabry disease. So meaning maybe you have a wearable like a watch that will give you electrocardiographic data. So like an Apple Watch can give you sort of a single lead snapshot into your heart rhythm, for example. But there are other opportunities. You may have a blood pressure cuff. You may have a set of scales. You may have a glucometer, whatever the case may be. Any of that information that ultimately makes it back to your provider is remote patient monitoring. And for me, in my world, as long as those data have veracity, meaning they're accurate and reliable, more data is typically a good thing when it comes to patient care, as long as you can adjudicate it in a timely way, in a reasonable way. So wearables are a big part of that. Some wearables give you blood pressure information. Some wearables give you heart rhythm information. But the takeaway on that is a simple thing is that if we could get information on you essentially continuously, and we could do it every day of the year, that gives us a lot of data to look at, right? So maybe we'll come up with some diagnostic opportunity for you that maybe you have atrial fibrillation or maybe you have sinus bradycardia or whatever the case may be. But so that part is a diagnostic component of a wearable,
Okay.
right? So, and we know that like Apple Watch is FDA cleared to diagnose things like atrial fibrillation. And similarly for little devices you can put on the back of your phone, you can put your fingers on there, it'll give you an ECG tracing. So that's one component of where wearables have value. But the other question is, could we use that information to predict future events? And that's kind of where I spend a lot of my research time. And what I think is the most exciting component of what we're doing is that what if I could use your personal data to predict your risk of having a stroke or a heart attack, or heart failure, or atrial fibrillation with a reasonable accuracy, more than 70, 80%. And we could forecast that over the next 5 years. So we look at your personal information and we can say, Julia, based on your ECG and your laboratory data and your genetic profiling and other things, that we think your risk of having atrial fibrillation is much higher than most people with Fabry, for example. Then that gives me an opportunity to better sort of pay attention to you, what I would say surveillance for you, right? So,
Mhm.
meaning I'm going to do more frequent assessments of your heart rhythm. Maybe I would even talk about putting a rhythm monitor inside your chest wall to look for those heart rhythm disturbances. So the wearables have lots of power. Part of it is diagnostic. Part of it is really about informing if your therapies are working reasonably well. Let's say you're on a blood pressure medicine and are your blood pressures where they need to be? That's where these kinds of remote monitoring opportunities come into play. And it's great because, as you know, when you go to a provider's office, maybe you're anxious, this idea of white coat hypertension. So blood pressures sometimes don't always reflect the real world. And the point is, what we really want to know for your blood pressure, for example, is what's happening on a day-to-day basis in a regular situation, right? Similarly for your heart rate, similar for your heart rhythm. And so, as opposed to getting little snapshots in time, if we can get more continuous data, that benefits the patient and it makes the provider's job a little more clear, I think, ultimately. So exciting times because anybody can buy a wearable now and you can use these things. And you can also get on these platforms to send in your blood pressure and other what we would sort of biometric data ultimately that are personalized to you. And as you know, I mean, Fabry care is complicated
Mhm.
diagnosis and a lot of potential comorbidities that come along with Fabry. Some people have these existing diagnoses, and then sometimes they're at risk in the future. We want to manage what you do have the best we can. So let's say you do have atrial fibrillation, we want to manage that really effectively. But we also would love to anticipate things before they happen in some catastrophic way, right? If we could anticipate you're going to have a stroke and make steps where you avoid that stroke, or maybe you avoid some of the impact of that stroke to lessen the impact on the patient. That's really where the opportunities lie. Most of what we do in medicine and cardiovascular medicine currently is reactive. We
Mhm.
wait for people to have a heart attack. Wait for people to have a stroke. We wait for them to have heart failure. And unfortunately, a lot of damage has been done at that point. And so, if we could predict disease and try and intervene to maybe mitigate or lessen the impact of that potential outcome, that's really what we should be striving for.
Absolutely. I think, I'm already loving this conversation because I think as a patient listening, I'm feeling, that there's power in information. There's also power, it sounds like, in intervention, in knowing things earlier. And, I think that when patients have more understanding, we're going to make better decisions. When we have this is showing us that we have an opportunity to actively participate in our own care. And that is so important. Is there any specific wearables or apps that you would recommend to us or to your patients to track our data?
You know, I don't. I personally, I have an Apple Watch which I use for my own sort of health, but I also have a Samsung Watch which gives me interesting information. Part of what informed my decision making, I'm a cardiologist, so I like the idea of being able to track my heart rhythm. So, but not all wearables do that, and you may not necessarily need that component. What we would say is whatever you. So the most important thing about all this, in my opinion, is that you can collect these data no matter what app you want to use or what wearable you want to use. But if it never makes it into the hands of a healthcare provider, it can't be leveraged. Then you own the data and you're responsible for trying to interpret it and trying to react to it, which is really not fair to the patient, right? I mean, that's not a reasonable request to ask, I don't think. So my point is that whatever you do, try and partner with your healthcare provider team, and hopefully the listeners have multidisciplinary teams. That would be the goal with Fabry, is to make sure that they have access to those data as much as possible. So you can go through it in sort of a joint partnership decision making, not only the provider, but the patient as well. Obviously, you want to use something that's reliable, that we think has accurate representation of the data. And so, if people are interested, there are a lot of great websites and a lot of good learnings that you can accrue to personalize, meaning not everybody necessarily needs to look at their heart rhythm per se. I would still advocate, I think it's an important thing in Fabry longitudinally, but maybe they're more concerned with their kidney function. So maybe that's more weight related or blood pressure related. Whatever you're doing, just work with your team to make sure that you're collecting the data that are really important to you and your diagnosis, and then that they have access to those data. And it needs to be bidirectional. It's great if I'm feeding information to my provider, but my provider also needs a mechanism to respond to me on how to react to this information.
Makes sense. And so, right. And so I'm thinking, okay, so there's this thought that I think a lot of patients have. We don't want, and we need to probably address it, but physicians are really busy, and we go in there, and sometimes I think I myself can be guilty of not wanting to take up too much of their time. And so let's say I have an Apple Watch and I notice that I'm dizzy or I'm feeling a little bit shortness of breath, I do have bradycardia. So I'm looking down and I see it's in the 50s or 40s. What do you suggest? What happens to, what does a patient do to then, do we just take a little screenshot of that?
Exactly. Exactly. And Mary, so we would call timestamp that with the symptoms that you were having, right? And you bring up an important, well, a couple of things. One is that remember, um, you are, it's my obligation as the clinician to listen to you. And if you don't ever walk into, and this is just patient advocacy, but don't ever walk in thinking, well, I can only talk about one problem because that's all he or she has time for. No, this is your time with the clinician, and you should tell them the things that you worry about. And remember also, an extension of that is if you don't always have time, there are patient portals and other ways that you can communicate with your providers, right? But you bring up an important point is that there are actually two verticals you can think about with wearables and symptoms. So one is that you felt dizzy, you look down at your watch and your heart rate was 42. Like, wow, maybe that's why. But what about you felt dizzy and your heart rate was 74? Well, then it's maybe not cardiac, right? So it's not only cluing you into when you have cardiac concerns, but it also says sometimes it rules out cardiac concerns, and that means you should look for something else, right? Maybe it feels dizzy because you have carotid stenosis or that you're hypovolemic or who knows, right? My point is that the wearables, any more data gives you the opportunity to rule in a diagnosis, but it also gives you the opportunity to rule out, which is very helpful.
Absolutely. Yeah, I love those. I love all of those points. Um, are there AI tools currently being used in clinical practice for Fabry patients?
Not so much as a standard of care, but that's kind of the goal. Most of what we do is still what we would say largely in a research domain. As you know, we've published information on how to identify patients, and for the listeners, we used an AI algorithm a few years ago to look at a large data set of patients to identify people who have Fabry but had never acquired a formal diagnosis, right? So how could AI go into an existing medical record and look at all the little phenotypic biomarkers that we know are consistent with Fabry? So maybe early stroke, atrial fibrillation, kidney disease. And you start pulling those things out of an individual record and you amalgamate that information, well, then it's more likely than not that maybe that patient has Fabry, right? So we identify people who we think are at high risk of Fabry, and then they ultimately get tested, and we can adjudicate whether they actually have the diagnosis or not. So that gives us an opportunity to identify people that haven't been diagnosed that otherwise probably wouldn't be because their clinicians aren't thinking about it. They're not thinking about it. Without a family history, maybe there's no reason for it to even come up in conversation. And as we said, the phenotypic representation of Fabry, as you know very well, can be very heterogeneous, even within the same family. So people aren't always thinking about this. AI can help identify people who may have Fabry who otherwise just won't be considered as having the diagnosis. But then we can extend that even more and exactly what we were just talking about. What if we could use your EKG tracing to predict if you're going to have a stroke or atrial fibrillation? And those are some of the research things that we're currently working on now. As you know, for things to make it into standard of care, we usually need a fair amount of evidence and support that actually is a reliable vehicle or mechanism. But I think we're getting there. It's really exciting. And because AI is burgeoning in everything else in society, it's sort of coming along. This is not a rare idea of using AI for anything. Now AI is used
Right.
for practically everything. So I think it helps us in medicine that this isn't some nuanced, unusual, provocative idea that's only for research. We know that we use it in everyday life every day now. Most people on the planet. So the idea that we can start incorporating this more aggressively into medicine, obviously the stakes are higher. You want to make sure if you're calling something out in medicine that you're as confident as you can be because people's morbidity and mortality may be hinging on that. So the wheels turn a little bit slower. But I can tell you confidently there is a lot of interest in AI and Fabry, so which is hugely exciting.
Really exciting and really hopeful. That's very hopeful for patients to know and for patients to hear. If you could fast forward 10 years, what advancements do you hope we've made for the Fabry patients?
Yeah, wow, that's a tough one. Um, I guess it would be multifactorial. So the first thing is that I wish we had a better mechanism for people that actually have Fabry to be identified. So we know there are effective therapies out there for Fabry. We know there's good multidisciplinary care, but so many of people living out there with Fabry don't know they have Fabry. So it's impossible to get plugged into these or get the right therapy if you never harbor the diagnosis. So for us, I think in the Fabry community, cardiology, genetics, nephrology, we all sort of say the same thing over and over. It's back to education and awareness to think about Fabry and the patient in front of you, right? Some states, as you know, in the US, have proactively started doing newborn screening for Fabry, which I think is a very positive step in the right direction. So one would be for those people that really have the disease, can we have a more reliable mechanism of diagnosis, awareness and diagnosis?
Hmm.
And then once we get to that, then well, how are we going to effectively treat? And the question always comes back, especially for single gene disorder based diseases, is there some sort of curative mechanism, meaning things like gene based therapies and that sort of business? And I think that's another thing that would be interesting is if we have broader therapies in our armamentarium to mitigate the effects of Fabry, whether those are really correcting things at the DNA level or just having more expansive therapies to treat the effects of the disease, whether those are cardiovascular or kidney or cerebrovascular or things that we don't really do a great job, I think, currently with, are things like pain. Do the therapies that we offer really deal with pain? Do they deal with gastrointestinal issues? Do they deal with CNS issues? And I think most people that manage Fabry would say we still have some work to do. So I think more effective diagnosis would be wonderful. We'd probably never get to 100%, but if we could get close to that, I think that would be great. And then once we make that diagnosis, is do we offer the most comprehensive therapeutic strategies out there that we can? I think those would be two tremendous accomplishments if we could do that.
Me too. Yeah, me too. When we were at the World Symposium together in February, I had the honor of being on stage with you, and we spoke about the importance and value of the patient physician relationship and the partnership. You said some of the best things I have ever heard a physician say that day. And I hope you remember what some of those things were, because I would love to ask you, why is the partnership so essential in your view?
Well, it's very kind. And just for your viewership, Julia was the star on the stage. I was just there talking. So, but that being said, so much of medicine has always been housed historically around this sort of paternalistic approach, where the clinician is the expert, right, and the physician is and the patient is just sort of along for the ride to do whatever they're told. And what I encourage people to know is, for better or worse, I have a lot of education, I have a lot of degrees behind my name. But there is only one expert on Julia's condition, and that is Julia, right? And that's the same for every person that's listening to this. You know more about yourself and your condition than your clinicians ever will because you live with it every day. And we look at objective data sometimes. We look at cardiac MRIs or we look at kidney biopsies or whatever the case may be. And that gives us a piece of the picture, but it doesn't tell us the entirety of the picture. And so I feel really strongly the only way that we can advance care in Fabry or any other chronic disease is that it has to be a partnership, right? It really has to be a partnership where it is the patient and the provider, those group of providers. And I would even extend it in Fabry. It's not just the patient, it's the patient and their families. Because one, the families are affected. And two, because it is the heritable nature of this disease, other family members are affected. So the messaging has to be consistent. I think we really And you alluded to this, and it's one of the limitations of healthcare currently is that we're being asked to do more with less, right? Less time, less resource, less infrastructure, whatever the case may be on the clinician side. But that doesn't obviate our responsibilities to the patient, and we still have to do the right thing. And I think the patients being advocates for themselves, their families, and the community, which is what you do, is just an absolute mission critical component to all of that. So speak up to your clinicians, tell them what you're thinking. And remember, some of the nidus for great research ideas can come from patients, right? You can tell us what are the unmet needs. We, as a clinician, I get asked this all the time on advisory boards and everything else. It's like, what are the unmet needs in Fabry? Well, I have my own ideas. I mean, we help publish the literature and we read a lot of stuff, but I don't live with the disease. You could offer so much in the gap of that knowledge that I just think is potentially transformative in what we do. So I hope that's part of what we talked about for sure. Is that I just think patient empowerment is hugely important, and then it has to be a partnership moving forward, because these are these are your lives. We talk about different therapies and the quality of life impacts and all these other sorts of things that have to be part and parcel of that decision making. I can write a script for XYZ,
Mhm.
whatever therapy we're talking about. But when you walk out of the office, I move on to the next patient. You're the person that actually has to live with that decision. And so I think we have to be thoughtful as clinicians, slow down, listen to the patients, and actually hear what they are saying, and things will go a lot better.
Yeah, I love that, and I think it's so important for patients to hear that from you. I think sometimes sometimes I have these thoughts. I have 2 young children, so I have these thoughts sometimes about the roles of a parent and a child, and how let's just use healthy eating for example. It's like the parents are saying, eat your vegetables or eat the protein on your plate, and that can only go so far, because if they don't understand why this is so important, if we say, you can kick that soccer ball so much far further, you can hit the ball fast, you can go faster, you can run faster. That's them fully understanding, and that's their choice, right? They get to decide when they're looking at their plate, okay, you know what, I think I want to hit the ball out of the park tonight, you know
It's
and so for patients listening, I think they need to know that their physician across from them is a team. They're in the same team. They're trying to accomplish
absolutely.
the best health.
And that's something that clinicians could do better. Back to the time constraints and other sort of expectations in medicine. But how often is that we hand out a prescription for something? Let's say it's for ERT or for chaperone therapy, or maybe it's something cardiovascular specific. We're doing something for your blood pressure, your kidneys. Do we ever actually sit down and explain exactly what you just said? It's like, the reason I'm giving you this medicine is because boom, 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 right? As opposed to saying, here, just take this medicine. We think it'll help. That's an opportunity for us to empower the patient to better understand why I'm giving you that medication. Why is it important to continue to take it? And so much of what we deal with in medicine, which is probably applicable to a lot of aspects of society in general, is just better education. We need to do a better job of explaining ourselves.
Yeah. Yeah, I think so too. And for the patients listening, I think it's important to, when you get in that room, even if you have some fears, or even if you're, you can feel nervous, but still, like Dr. Jeffries said, ask the questions that you have, and know that you are a part of this. You are shaping your own health story in there.
And I think
Yeah.
it's also important for people to recognize that if you're not getting the answers that you think you need, or that
Hmm.
people aren't imparting the kind of time or energy to you, there's always the opportunity to look for other providers as well. And that's something that isn't talked about as much in healthcare as it should be. You are the captain of the ship, right? You are the patient, and if you don't feel like someone is doing what you expect to at least be a reasonable standard of care, work with people like Julia or other patient advocacy organizations to find providers that can really be intentional about your care, listen to you, offer you the latest and greatest. Because, as you all know, I mean, this is not commonplace. As a cardiologist, I specialize in Fabry, so I enrich my population. But most cardiologists maybe see one or two in their career. So it's not because they don't want to help; it's because they're just not as familiar with this all the time. Some clinicians will take the prerogative to learn more, and some people maybe don't because they're inundated with everything else that they're doing. It's up to you to recognize that. I think occasionally say, well, maybe this person would be great for my heart attack, but maybe they're not the best for my Fabry care, and to work with organizations to find someone who would be.
Yeah. Yep. Great thoughts. Great conversation, and thank you for sharing all of that, because it's so important for patients to hear. I think that coming from a physician as well is very nice. Okay, are you ready for some rapid fire?
No, no, yes, of course.
Yeah. Okay, I'm feeling you're going to be great at it. So, okay. So, 1 month, one myth about Fabry in the heart you'd love to bust.
Um, Unfortunately, a friend of mine lived through this. Is that Fabry patients are often told they're not candidates for what we would say standard of care cardiovascular care. So let's say you have end stage heart failure. In my world, maybe you might get a thing called a ventricular assist device. We might even move you forward to a transplant, right? People sometimes with Fabry are told, well, you're not a candidate for a transplant because you have Fabry disease, which is absolutely not true. That is a horrible myth. And in my world is I- just really disappointing, I guess. And patients are fed the wrong information. And that means that they may die with something that was avoidable with the use of a transplant. So I wish we could get away from that myth.
That's a good myth to bust, and that's a great message for everyone to hear. Um, True or false? A normal EKG rules out cardiac Fabry involvement.
False, it doesn't. So, as we talked about, kind of the way that cardiologists speak to each other is that we have electricians, which are people that deal with the rhythm stuff, which is the EKG, the little squiggly lines. Sometimes we have plumbers. Those are the people who put the stents in and all this kind of stuff. I'm more of a heart muscle doctor, so that's what heart failure people do. So the point is that the heart is not just a heart rhythm. It's not just a muscle. It's not just the coronaries. It's all of these things, right? And so you could easily have a normal EKG, but have heart muscle involvement, for example. Or you could have normal heart muscle and have an EKG. The point is, good cardiac care looks at all of those things.
Great. Then I'll ask this question because it follows up to this one. What is the gold standard cardiac test that helps us best understand the heart?
Yeah, unfortunately, it depends on the problem, right? If For me, as a heart muscle doctor, my sort of gold standard test is a cardiac MRI. That's what I look at probably the most frequently because it tells me the size and the thickness and the shape and the function of the heart. But it doesn't tell me about the electrical piece. So,
Mm-hmm.
so a gold standard in that scenario, oftentimes in contemporary care, would probably be something like a loop recorder, which is a little insertable device that gives me continuous monitoring of the heart rhythm for many years. But some of it really just depends on what we're talking about. If it were a blockage in the coronaries, let's say you had an early heart attack, which we know can happen, then that would be a coronary angiogram, for example. So it really does depend on the problem that's in front of us. But a gold standard, sort of standard of care for Fabry care should include a cardiac MRI. Usually would be my statement.
Okay. One thing you wish every Fabry patient knew.
That there are opportunities, that there's hope. You said this, Julia. I think the hope is such a great thing, and that there are people out there that know about the disease. Um, you know, some folks maybe are relegated to seeing the people in their local community, and those people really aren't as familiar with Fabry. And we hear this even on the patient side, is that, well, my providers told me they were doing all that they could do, and more often than not, that's not true. They just aren't informed about Fabry. And so I think what I hope this vehicle shows people, that it illuminates to them, is that there are other opportunities through your organization, other organizations, to connect you with people that know more about the disease and that can offer hope. And that, as I said, there is so much, we've never had a time that I'm aware of where there is more active research in the field ever than now. And so, how do we change the narrative? We change it through the research component. So don't give up would be the message. Don't give up, because there's a lot of opportunities.
Yeah, that's wonderful. Okay, second last question. True or false? Can lifestyle changes really make a difference in heart outcomes in Fabry patients?
Can This is kind of an interesting concept, and it takes people a while to digest it occasionally. If you live with a heritable disease, is I have Fabry, and I have this set of risks that I'm paying attention to, right? Heart failure and arrhythmias and stroke and whatnot. But as you get older, that doesn't preclude you from getting all the diseases that everybody else in the world gets, right? So hypertension and coronary artery disease and all these other sorts of things. And we know a lot of that is lifestyle driven. So one is that you can easily have the heritable disease and then layer on top of that obesity and hypertension and diabetes, right? Which makes all of this stuff in the Fabry piece much worse, much harder to treat. But that being said, independent of that, can exercise help your cardiovascular health in the setting of Fabry? Of course it can. Can these sorts of things, mitigating blood pressure, avoiding glucose intolerance and ultimate diabetes, does that make a big difference? Absolutely, it does. So people always forget, I think sometimes forget, well, I have Fabry, but remember, common things are common. So as you get older, inherently, we all have a risk of atrial fibrillation, for example. If you get into your 80s, you have a higher risk than normal of atrial fibrillation. Because you have Fabry, your risk may even be higher. So I think lifestyle stuff is so important. We don't talk a lot about this in the Fabry community, but you're supposed to have pulmonary function tests as a part of your Fabry surveillance. Why? Because we know lung disease is a component. Obviously, smoking would not be a good thing in that setting, for example. So absolutely, eat healthy, exercise, do the right thing. Everything your physician is probably already telling you, but I'll try to
Yeah.
reinforce it a little bit.
Yeah, that's great. That's great because it does give us one more thing that we can do in our control. It's like we're hearing and we're saying, okay, there's things we can do, and that's where the empowerment piece comes in. Yeah. All right, last question, Dr. Jeffries. You're the cardiologist for the Memphis Grizzlies. What do elite athletes and Fabry patients both have in common?
Um, I tried to think about this a little bit, and I'm not sure I have a pristine answer. But what I would say is that both groups sometimes are viewed a little differently than everyone else. And all of their NBA athletes, so they must be ultra healthy and they don't have any problems and they have access to the best of the best. Fabry, we don't know a lot about that. We're going to treat them a little differently because they're not like everyone else. And as we've just said, that's just not the case. Meaning that both cohorts, both the Grizzlies and Fabry, should have access to things that everyone else has access to: typical care, typical therapies, all those sorts of things. And I think both groups are viewed as outliers. The Grizzlies, they're elite athletes and blah blah blah. Fabry, small population, complicated, don't know a lot about them. But my point is that if we think about these two populations that way, oftentimes we fail to pay attention to other things like what we just talked about. Could you just have high blood pressure? Could you have diabetes just like anybody else in the world? Absolutely, you could. So for me, I think it's more about not treating people as outliers, but trying to bring them in as much as possible into sort of conventional thinking, and never allow yourself not to offer them the therapies that you would offer to someone else if they make sense. But that was a tough question.
Yeah, I love that. I love that. Well, I think that's a great answer, and I really genuinely love your thoughts. I really do like the way you think about, your patients. I like the way that you think about things in life. I have heard you on stage and other podcasts, and I think your thoughts are just really lovely, and they're really something to be shared. So thank you. You've been, I think you've taught me a lot today. You've taught our listeners a lot today. I appreciate you and everything you're doing for Fabry patients.
And absolutely, thank you for the opportunity. I love this. As you know, I've been advocating in the Fabry space for over a couple of decades now, and it's just something that I feel strongly we have so many opportunities, and things like your podcast are how we bring people together, arm in arm, to do the things we need to do to advance the field. So thank you very kindly for the time.